Here's a USMLE-style question focused on heart catheterization. USMLE question on heart catheterization. A 58-year-old man with a history of hypertension and type 2 diabetes presents to the emergency department with chest pain that started 30 minutes ago. The pain is radiating to his left arm and jaw, and he is diaphoretic. An ECG shows ST segment elevation in leads V2, V4, suggesting an anterior myocardial infarction. The decision is made to proceed with urgent cardiac catheterization to assess for coronary artery disease. Question: which of the following is the primary purpose of performing heart catheterization in this patient? Option A, to assess left ventricular function. Option B, to evaluate coronary artery patency. Option C, to measure pulmonary artery pressures. Option D, to determine the ejection fraction. Option E, to diagnose pericardial effusion. The correct answer is option B, to evaluate coronary artery patency. Explanation: heart catheterization, or coronary angiography, is the gold standard for assessing coronary artery disease, CAD, and evaluating coronary artery patency. In this patient with suspected acute myocardial infarction, MI, catheterization is performed urgently to determine if there is a blockage or significant stenosis in the coronary arteries that could be treated with interventions like angioplasty or stenting. Left ventricular function and ejection fraction are important clinical parameters, but they are typically assessed using echocardiography or nuclear imaging rather than catheterization. Pulmonary artery pressures are measured during right heart catheterization, but this is not the focus in a patient with an acute MI. A pericardial effusion can be diagnosed with echocardiography, not heart catheterization. Heart catheterization is a diagnostic and therapeutic procedure commonly performed in patients with acute coronary syndromes to assess for the presence of coronary artery blockages and guide subsequent treatment decisions.